Welcome to this week's Oregon Minute. This week we are doing a check-in with the Oregon Area Senior Center, and today as our guest we have Director Rachel Brickner. How's it going, Rachel?
Fine, Emily. How are you?
Doing pretty well, considering we're still amid a pandemic, and that's of course what we're talking about today is how the Senior Center continues to adapt to pandemic conditions. So, Rachel, we have a variant, variants, we have a vaccine on the rise, vaccines, and how do things continue to go at the Senior Center?
Well, the Senior Center is doing its best to get information out there to people about the vaccinations. We just learned yesterday that there will be transportation options for seniors who don't have a way to get to vaccination appointments to be able to connect with transportation so they can get there. We're really very fortunate because we have good connections with public health, Dane County, and they're guiding us with regard to when it might be safe to expand some of the opportunities that we offer at the Senior Center. One, we'll be able to have more people in our building, but in the meantime, we've done pretty well at continuing to provide services to people on a remote basis or a touchless basis. So many of the Senior Center's services have continued throughout this, almost 11 months now of the pandemic.
And give me some examples of how some of these valuable services that the Senior Center offers had to pivot and continue to pivot during this time.
So one of the things that a lot of older adults rely on the Senior Center for is meals. We previously had some seniors who came to the center and ate lunch there 4 days a week. 1 day a week, they went over to Ziggy's restaurant and enjoyed a meal there. Plus, we had a number of seniors who had meals delivered to their homes every day, people who are less able to be out and about. So when the pandemic hit, we knew food was going to continue to be an issue, and we also knew it wasn't going to be safe for people to come into the center to have those meals or to go into Ziggy's restaurant and sit down and eat those meals. So we shifted to an all home delivered meal system initially. After a couple of months, we were able, in partnership with Dane County and Ziggy's restaurant, to open up a drive-through meal line twice a week at Ziggy's. We also pivoted to working with Dane County to create a touchless grocery delivery system and an opportunity for people to have food pantry supplies delivered to their home. And as we look back on that, we can see that we actually got just under 15,600 meals into people's hands. That's just the meals. That's not the groceries or the food pantry units. And that was about a 36% increase in meals over 2019. So we had to expand our program quite a lot. We ended up recruiting a lot more new volunteers that were not in high risk categories and getting them trained. We added a fourth route to our home delivered meals. We previously had 3 routes. We needed to increase that. So food became a big part of what we were working with during the last 11 months. We are hopeful that at some future point we'll be able to have our meal program congregate where people can come together and eat again. But for now, that's not on the near horizon. I don't know that the food program is going to be able to change very much very quickly.
Do you think the deliveries are something, because there are a percentage of seniors that are homebound and of course can't leave their homes, but so do you think that the delivery services are something that might or at least the expanded services are something that might stay even after the pandemic, as well as reinstating the ability for seniors to congregate?
So we had home delivered meals prior to the pandemic, and we will continue to have home delivered meals. But it's really important for the seniors who are able to get out to come to the center and be with other people and get out of the same four walls. And so we do have a transportation system in normal circumstances that goes around and will pick people up and bring them into the center so that they can enjoy other people's company, maybe stay for an activity. So we're looking forward to getting back to that, but I believe there will always be a component of home delivered meals for people who really do need to stay in their homes. Um, but prior to the pandemic, there was an opportunity for people to go grocery shopping where a van would come to their home, pick them up, take them grocery shopping. I anticipate that that will resume once it's safe for it to resume. The same thing is true of the food pantry. We had van service for people who wanted to go to the food pantry but didn't have the opportunity or couldn't get there because of transportation. So whether some of the delivery programs, the grocery delivery programs, or the food pantry delivery programs will continue will depend in part on Dane County's decisions about how they want to spend the dollars that they have available for transportation programs.
Well, thank you for clarifying that. And what do you hear from patrons who use the senior center who value these services, especially during the pandemic?
Oh, we've gotten such wonderful notes and cards and calls from people saying, the volunteers are wonderful. I don't know what I'd do without this service. Um, we had one recently from a person who told us she had barely left her house since last March and that she really looked forward every day to having the volunteers come and drop off her meal. And even though the volunteers are having to socially distance and can't go in people's homes, they drop the meal off and they step way back. They ring the bell, they step way back. They make sure the person comes to the door and gets their food. They may have a distanced conversation. Sometimes that's really about the extent of the human face-to-face interaction that some of the meal recipients have, and they really, really appreciate it. So people have been very appreciative of this. People are also really looking forward to the wider availability of the vaccine so that they can feel more safe about getting out of their homes and encountering people again. Looking forward to the day when the senior center is a little bit more like they remember it.
As the director of the senior center, did you ever envision that you would have gone through what with your staff and with the patrons that you've gone through within this last year? Like, did you ever imagine that you would be guiding the senior center through a pandemic?
No, 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 I certainly didn't. I don't think any of us anticipated this, but every year, um, the senior center creates, updates an emergency plan that focuses our attention on what do we do in unusual circumstances? How do we respond? How do we move with some speed and with flexibility to meet the needs of an unexpected emergency? And just the exercise of doing that makes us think about what would we have to know? What would we have to be able to do? What skills would we need if an emergency ever arose? Now, I've often thought that there would at some point be some kind of an emergency that we would respond to, but in my mind, those emergencies tended to look more like natural disasters or the gas explosion in Sun Prairie a few years ago made us all think more about those kinds of disasters. But I can't say that I ever really envisioned that the emergency that we would be responding to would be a widespread pandemic.
I think that's a very, very fair answer. Yeah, like I agree that none of us ever anticipated this. And I was talking with we talked with a vaccine expert on this show a few months ago who said the same thing. They anticipated that a coronavirus epidemic would occur, but just not. They never predicted that it would occur at the scale that it is right now. But I will say that I am getting a little tired of living through historical moments. I don't know about you, Rachel, but but um, so and that that there's another question that's been raised in my mind, and it's we know that seniors are a population that has been disproportionately affected by the pandemic because they are the most vulnerable, those 65 and older, and that's why they are being vaccinated after healthcare workers. So, but yeah, besides being most vulnerable, what are some ways this pandemic has disproportionately impacted seniors and senior center patrons, you think?
Um, that's kind of an interesting question. There's two sides to that. Though on one hand, seniors many of them don't have to go out into the workforce, and so they don't have some of the um, what do I want to say? They don't have some of the social contacts that other people have, whether they want them or not. They are limiting their exposures, so they're not out and about. And I think that it can be difficult to remain feeling purposeful when you can't go out and do the volunteer work that you're used to doing, or help your neighbors the way you used to help them, or even interact with your family members the way you want to. It's it's difficult, and yet several seniors have told me over the months that this pandemic has been going on that in some ways they feel like they're luckier than some of their younger counterparts. And that's because, on the one hand, economically, a lot of seniors feel that their fixed incomes are relatively stable. They have Social Security, which isn't changing because of businesses having to close. They may have retirement plans that aren't changing because of challenges in the economy. So they feel, in that regard, lucky. They also feel fortunate that they don't have children in the school system, because a lot of seniors have expressed to me how much they understand and appreciate what kind of a challenge that must pose to younger families who are trying to um, continue to earn livings, but also supervise children in schools and make decisions about whether their kids should be learning virtually or can go back to classrooms. And so, in some ways, even though a lot of the seniors are experiencing a lot of loss right now, a loss of their usual routines and a loss of their sense of um, purpose in some ways, they also are conscious of the fact that in some ways they are um, more um, more lucky, or in a better position than they might be if they were younger while they were going through this pandemic.
I will admit, Rachel, I've never thought of it that way. I've never thought that when I've thought of the most vulnerable populations to COVID, I never thought that of some of the economic privileges, I will say, that maybe the baby boom generation had in comparison to my millennial generation as well as Generation Z. And so those people that you've talked to have raised a really good point. And in fact, I think of people like my father, who he's a retired educator and educated, excuse me, retired when he was around 62, and he's within that age bracket where he is really vulnerable to COVID, and he is in a position to not have to really leave his house that much unless it's for grocery shopping or things like that. So that's a really interesting point. Rachel, I think that's all of the questions that I have. But I'm wondering if there's anything else you would like to add on the show today.
I'd like to thank the community for the support that they've offered to the center over the last year. The number of people who came forward to volunteer, to deliver meals, to package meals was really, really heartwarming. that when our usual volunteers couldn't continue because they were in that vulnerable population, and we needed people to help us get this large increase number of meals out, the volunteers were right there. And not only do I want to thank those volunteers, but I want to thank all the people in the community who have kept seniors in mind, both with donations. We've had a lot of generous donations from people who've helped us continue to provide services for seniors, but also people who did things like make Valentines to put in meal bags, or create Christmas packages for seniors who weren't going to be able to be with family this year. And just there's been a lot of very generous acts on the part of the community to help keep older adults safe and supported, and knowing that they haven't been forgotten. And I would just personally like to thank the community for all those efforts.
Well, and a thank you to you for all the work that you continue to do for the Senior Center, Rachel, and also for appearing on the show this week. I know you have a very busy schedule, especially as the pandemic continues to rage on. But with that said, to all of our viewers, thank you for tuning in to this week's Oregon Minute. Tune in every Thursday at 7 p.m.
Thank you, Emily. Thanks for asking me to be here. Take care.